very good afternoon to all of you. Greetings for the day. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be doing really good. You must have come across people, especially women, with brown color patches on their face. They look like freckle, like spots forming large, flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across four Indian cities, reveals that more than 80% of the population presents skin color heterogeneity on the face, irrespective of their age and gender. This heterogeneity mainly results from hyperpigmented spots and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in the treatment. So, to avoid all these hassles and to keep you informed, today we are here to know about the management of melasma from an expert. So, let's connect today with our skin expert, Dr. Barnita Gupta, live from Rohtak, to talk on melasma and its management. Dr. Barnita Gupta completed her MBBS, followed by MD from Lady Haddon Medical College and associated hospitals. She has participated in many national and international conferences and has publication and research article on her name. She believes in fostering a strong doctor-patient relationship, ensuring that each individual receives personalized and compassionate care. Dr. Banita stands as a beacon of expertise and compassion in the healthcare community. Today, we are privileged to have her with us, and she will be sharing insights on melasma and its management. We extend our heartfelt gratitude to you, Dr. Banita, for joining us. A very warm welcome
Thank
to
you.
you. So, Doctor, as today we are going to talk about melasma. For first of all, what is melasma?
Melasma is a type of hyperpigmentation which is generally seen as a brownish blotchy patches on the face, usually in the middle age group, more common in females as compared to male. So it is a pigmentary condition basically.
Okay, doctor. Doctor, what causes melasma? What are the causes of melasma?
The causes of melasma is multifactorial. So there are certain hypotheses, but along with some medical proof in it. So the first is a genetic predisposition. Second is a family history. So siblings or mothers who have a tendency of melasma. So in the next generation, the time is 10 to 20 times more common in their children. Thirdly, UV exposure. Those who are more exposed to sun rays, they more have a tendency to have melasma. Then patients who are on oral contraceptive pills or some hormone replacement therapies and even some IUCD patients can also develop melasma. Some medications like phenytoin, thyroid medications, hypertensive medications are also associated with melasma. So these are some theories which has been proposed on the causes of melasma. Pointing out to one is not possible, but all this contribute in total together, giving rise to melasma.
Why it's more common in women, doctor? Is it due to the hormonal imbalance issues?
Yes, little bit it is more common in female because of the pregnancy, because of the hormonal imbalances, more commonly in patients of PCOD, which are more common in female population. And women also sometimes are more exposed to sun, whether they're indoor, but they go out to do their household works and they don't use sunscreen. So that's why the prevalence is seen more commonly in the women population.
Okay, doctor. Now, doctor, what is the difference between melasma and hyperpigmentation? Because, as a layman, we are not very used to the term of melasma, but we do know about hyperpigmentation or pigmentary issues. Are they same or are they different?
No, melasma and hyperpigmentation is not the same thing. Melasma is a part of hyperpigmentation. There are multiple causes of hyperpigmentation, like hyperpigmentation can be due to post acne. The acne marks is also a type of hyperpigmentation. Hyperpigmentation can also be post drug induced allergies. Can be because of some cosmetic use. Then there are various types of other types of hyperpigmentation, which medically we say is erythema dyschronicum persistens, lichen planus pigmentosus, ACDs, which are which can again give rise to hyperpigmentation. So basically, hyperpigmentation is a broader term, and
Hmm.
melasma comes under the subtype of hyperpigmentation. So it is not the same.
Right. So So hyperpigmentation is a umbrella term, and melasma falls under it. So it's not the same, of
Yes.
course. Doctor, now talking again about melasma, what are the signs? I mean, how does it start? So I'm sure we don't see a face full of pigmentation overnight. It starts from maybe some spots or something. Would you like to elaborate that for us?
Yeah, sure. So, most commonly, female population in their middle age, like from the 20 or the 25 years of age, can see some brownish discoloration on the central part of the face, like the upper forehead, the central part of the cheeks, the upper nose, the upper lips part. So, it starts from this place, basically, most commonly, and then it spreads out in a very slow, gradual way to involve sometimes the entire cheek or the middle part of the forehead. So it is a gradual process, not a single drip process. So if the patient does not take care of her skin routine properly, does not use sunscreen, and is also on some hormonal pills or some other medication, so it keeps on progressing, and then it can involve almost a half of the face sometimes, or more than half of the face even.
So it occurs
And
only on the face, or anywhere else also can we have melasma?
90% of the melasma occurs on the face. So there are three types of melasma which occurs on the face. The most common type is the centrofacial, the one which I've already described, the central part of the face. The second most common type of melasma is a malar melasma, that is on the corners of the face, the malar area. The third type of melasma on the face is a mandibular melasma, that is in the chin part.
Right. So there are these three kinds
The extrafacial.
types of melasma.
Yeah, one more point out I would like to mention is that extrafacial melasmas are also there, but these are very less common. The site most commonly are in the extrafacial type is the upper arm part, the forearm part, and the upper back. But these are very, very less common.
Right. So mostly we see melasma on the face. Now, doctor, as you said, it's a gradual
Yes.
process. We will first spot few
Yeah.
patches or brownish spots, and they gradually grow. My question to you now is regarding the prevention. As you said, sunscreen application is very important. Taking care of your skin is very important. Initially, you also mentioned when we were talking about the causes that family history also plays a part. Now, for example, there is a family history of melasma in my family. When
Mm.
should I start taking good care of my skin? What preventive measures I can go for?
The way nowadays the recommendation even says that we can start uh, treatment of melasma, not the treatment, I would say the prevention of melasma in the form of sunscreens, even after 6 months of age. So, wearing a good photoprotective sunscreen, which is broad spectrum, has both the infrared cover, the visible light cover, the ultraviolet light cover. So, this will help in preventing melasma and always maintaining that routine in their everyday life, whether they go outside or they don't go outside.
So, sunscreen plays a very important role in preventing melasma or delaying melasma, and
Yeah.
even for our overall skin health, it's very important to apply sunscreen. But as you said, even if you are inside your house, even if you are working from home, because this is a very common question that we have, that if it's not sunny outside, if it's raining or it's cloudy or it's winter, or I'm working from my house, or I'm working from a office which is completely air conditioned, why do I need to apply sunscreen regularly? I mean, we normally take sunscreen because it has the term sun as something to apply when we are under the exposure of sun. But as you said, whether you are indoor or outdoor, you need to apply sunscreen religiously every day. Why so, doctor?
It is because the sunscreen does not protect only from the visible light. The that we see in our atmosphere, that is the visible light, which is visible to us in the eyes. But there are certain lights like ultraviolet light, the infrared light, which are not visible to our eyes, but they are also present in the daytime in the atmosphere. So they also give rise to pigmentation of the face. Like we are sitting in an office setting, but we are looking at the screen, we are looking into the phone, in the laptop, in the lights, inside the room. All these are some blue light, some UV ray light, some infrared light. So all these give rise to pigmentation in total. So that's why whether we are going outside or we are inside in indoor place also, we should apply sunscreen daily. You starting from 9 a.m. in the morning, 8 a.m. to 9 a.m. up to 4 p.m. to 5 p.m. we say that we should have a sunscreen applied on our face.
With sunscreen, doctor, we also get to hear that reapplication, the amount of sunscreen that we are applying, they all play a very important role. Then again, how much time before stepping out we need to apply, etc., etc. Would you like to shed some light on that?
Yeah, sure. So sunscreen should be applied every 2 hours ideally, and up to 3 times it can be applied. Like if you have applied it at 9 a.m., you can reapply it at 11 or 12 p.m., then you can reapply it again at 3 p.m. in the afternoon. So, and if you are involved in some outdoor activity, like you have some field work or you have gone to the market or you are in some swimming activity, you should reapply the sunscreen before going out. It is said that half an hour to 15 minutes before going outside, we should apply the sunscreen because it takes at least 15 minutes to 30 minutes time for the sunscreen to become active to block the rays. And once we are stepped outside, every 2 hourly, if you are outside, you can reapply the sunscreen. Ideally, sunscreen should be applied. There is a finger rule method which we say, like a half teaspoon of sunscreen, roughly 3 ml of sunscreen, should be applied for the entire face and neck. Again, half teaspoon for each of the hand. 1 teaspoon for the entire leg and back and chest. So this is the teaspoon rule we say for applying the sunscreen.
Mhm. Doctor, when we go out to buy a sunscreen, there are so many informations, written on the tube or on the box containing the sunscreen, starting from SPF to boot star rating to PA rating, etc., etc. Then these days, thankfully, sunscreens are coming in so many formulations, from spray form to gel form to lotion form, etc. What to go for? What are the basics that we need to check before buying a sunscreen, especially if we are, dealing with melasma?
Yeah. So it all depends on your skin type. The main thing is
Okay.
that. So in a summer settings, in a patient who has oily skin, so we prefer silicone gel based sunscreen, which are having a light matte texture and is not that sticky. So in the winter like situation when the skin is little bit dry, the weather is dry, we prefer using cream based or lotion based sunscreens. So this is how the type of sunscreen, the texture wise you can choose. Then coming on to which sunscreen should I buy? The sunscreen which we prefer buying in a melasma patient, particularly because the topic is melasma. So SPF or a sun protection factor of 50 or above is recommended in melasma patient. So SPF of 50 means the UVB protection is almost 97% compared to an SPF 30 and or so. Now, there's a term also called boot star rating. The boot star rating can be 3 plus, 4 plus. The boot star rating indicates the UVA protection. The UVA protection, how much is the protection? So, a boot star minimum rating of 3 plus is preferred, 3 plus or above in broad spectrum sunscreen. And you should also see the level of broad spectrum mentioned in your sunscreen text, where broad spectrum means it is covering all the rays like the visible light, the ultraviolet light, the infrared lights, so that there is a total protection from all the type of sun rays. So ideal sunscreen should be SPF 50 or above, a broad spectrum, a PA rating of 3 plus, a sun protection factor of 50 or above, and also should be non-comedogenic, non-allergenic, and suitable for your skin type.
Fair enough. Now, doctor, because we are talking about melasma, which is quite common in our society, especially in women, we see a lot of people going to the nearby chemist shop to get any topical application, and they'll keep on using it for months before they realize that it's not working actually, and then that's when they go and consult a doctor. Or we are so obsessed with home remedies, or these days there are so many influencers on various social media platforms telling us what to do, what not to do, DIYs, etc. how would you like to address this? Do these home remedies, DIYs, or over the counter topical applications, etc., they work, or we need to actually go and take advice from a qualified dermat?
Definitely, we should go and take an advice from a dermatologist, because all the over-the-counter medications, all the claims that are mentioned in the social media, they don't bring about that much of result. And plus, it is having so much side effects. All the products that they sell on the OTC platforms, or they discuss about it, or the chemist shop even gives this kind of medication. They have steroid-based or hydroquinone-based molecules within that product. So, on the long-term use of such molecules on the skin, they can make your skin much thinner. The sensitivity of the skin increases. Long-term side effects, like in the form of rashes on the screen or telangiectasia, starts happening, because we keep on seeing such patients on our clinic on regular basis. So this is a big no no. Any home based remedy, any chemist shop application of topical creams, so just go and visit your dermatologist. They are the best to look into your skin type, the problem of melasma, and give your appropriate medication according to your severity of melasma. So over the counter
Right.
drugs is a big no no.
Yes, and even if there are people in your family, friends, relatives who many times it's also very common, they pass on their prescription to you, but then you have a different skin type. They had a different skin type. Your
Yes.
issues would be different, theirs would be different. So please go and consult a qualified dermatologist. Don't fall for quackery, don't fall for over the counter products, etc. Go to the correct person. Now, doctor, when a patient comes to you with these signs, are there any tests that you recommend, or just by clinical physical observation you are sure that this is melasma and then you decide the line of treatment?
First of all, melasma is basically a clinical diagnosis. So we don't do much of test, as I would say, to confirm the diagnosis, but we do get some tests done in order to know whether some underlying conditions have given rise to melasma. Like sometimes we get thyroid hormones checked in such patients. Sometimes patients who are having some medications and all, we take a good medical history of the medicines also, so which will help in supporting our diagnosis why the melasma has happened. But there is no direct test. Yes, to confirm the depth of severity of melasma, we do some clinical examination in the clinic. Like we have dermoscopy nowadays with all the clinicians or dermatologists. So by looking into the dermoscopy picture, we can know at what level the pigmentation has appeared in the skin, like whether it is superficial, whether it is deep type, or it is a mixed type. So this helps in aiding our diagnosis. But yes, melasma is always a clinical diagnosis, first of all.
Okay. And doctor, what are the treatment options available or procedures available for melasma?
So the first line of treatment is melasma is always topical medications. Topical medications which has depigmenting molecules, like in the form of glycolic acid, kozic acid, lycurase, resorcinol. Nowadays, cysteamine has come up. Very good molecules like mandelic acid. All these have come up in the market, and they have very promising results in decreasing the melasma. Along with topicals, we also write oral supplements in the form of oral tranexamic acid, oral vitamin C, as a supplementary medication to the topicals. In clinics also, we do some clinic-based treatments in the form of chemical peels, sometimes lasers, sometimes intralesional injections of tranexamic acid. So all these are additional treatments, but the main treatment stays with a topical application of depigmenting cream and a good sunscreen.
Okay. There are a few questions that are so common and people who keep on asking, can melasma turns into cancer or leads to cancer?
No, melasma does not turn into cancer. It is a benign skin condition, and it always remains like a benign condition only. Does not turn malignant.
Another very common question people ask here also, I can see a lot of viewers asking this question, that is it 100% curable?
See, melasma is not 100% curable, but up to 80-90% we can reduce the severity of melasma, but it has a tendency of a relapse.
Hmm.
If we don't continue with the medications and we don't continue the sunscreens, and there is continuous sun exposure, then sometimes melasma comes back again. So it is not 100% curable, but it is treatable. Yes.
Okay. Sona Mehra is asking, ma'am, what skincare routine is best for melasma?
Uh, if you're talking about a mild to moderate type of melasma, then a good face wash, which is having a depigmenting molecules in it, like a glycolic acid based face wash, along with some topical applications with some depigmenting creams, like as I told you, a licorice or a glycolic acid, mandelic acid, isocinol based creams, which are available in the market in the name Posivit Ultra, like Cosblo Neo, like Melaclo all this type of creams we can start using and follow it up with a very good sunscreen, SPF 50 plus at least in the morning. So that is the basic treatment that you should start in melasma.
Okay. Shania Sen is here. Her question is, do skin lightening creams help in melasma?
Yes, a lot. It helps a lot. So a good a depigmenting or a skin lightening cream which is prescribed by your dermatologist, that I would say highlight much, because there are certain steroid based or topical corticosteroid based medications which is available in the Indian market in the chemist shops, which people write also. Yes, there are benefits, but you should apply that type of creams under a supervision of your dermat. You cannot apply any skin lightening cream. The one that is recommended by your dermat, that is to be applied uh, by you, and also a good one, the one that she has mentioned. And on a short term basis, the OTC drugs can be applied, but not on a long term basis.
Right. Doctor, because we are talking about melasma and, how there are so many myths going on around with melasma. Here's a question by Neetu. Her question is, does melasma mean liver issues?
No, melasma is not associated with any issues, or sometimes people ask me, ma'am, is it because of any calcium deficiency or any vitamin deficiencies in the body? No, melasma is not associated with any underlying chronic skin conditions like liver or kidney or vitamin deficiencies, except thyroid disorder patients who might have association with melasma. So it is only the thyroid test which you can get done, but it is not associated with liver problem.
Okay. Now, as since we started the session, doctor, you have always emphasized on the use of sunscreen, especially in case of melasma, as a preventive measure. Also, you said sunscreen is very important, and as a part of treatment, also, of course. My question is, along with sunscreen, we are applying sunscreen. Along with that, what other means or physical barriers we should use, especially if there is a family history or we are at risk of melasma?
Yeah, so along with sunscreen, you can use a broad brimmed head. If you're going outside, you can wear a good quality sunglasses, wearing full sleeve clothes, taking umbrella along with you when you are in the direct sun. So this helps a lot to prevent melasma if you have a family history or a tendency of melasma in your siblings. Along with it, certain nowadays we also prescribe some oral pharmaceutical products like oral sunscreens, like in the form of vitamin C, vitamin E, oral vitamin B also. So sometimes this kind of tocopherols, green tea extract based medicines, green tea extract based medicines. So these are oral photoreceptor supplements. Wearing a good full sleeve cloth, wearing this heads and sunglasses also helps in preventing melasma a lot.
Okay. Doctor, you also mentioned that how pregnancy is also one of the risk factors, and many times we have seen women with melasma during pregnancy. My question to you is: does it, naturally fades away or goes away on its own after the delivery, or it stays, and again we need to take proper medication and treatment for that?
Yeah. So pregnancy is a condition where the estrogen and progesterone in the body of a female is on a higher concentration. So that's why the melasma usually appears for the first time during pregnancy, or it might increase in the intensity during pregnancy. Once the patient delivers, so it is seen that 30% of the patients has an improvement in the melasma, 30% has same intensity of melasma, and 30% patients might have the melasma almost gone, like 90%. So most commonly it usually decreases because as we deliver the child, the mother, the hormones again come back to the normal state. So the melasma improves. But if you continue having the melasma type of pigmentation even after delivering the child, you should seek an expert opinion and start your medications, because there are this medications which are saved during the lactation period in the mother. So you can start using that so that the severity decreases.
Fair enough. Doctor, before we sum up the whole session, any take home or closing remarks for our viewers on melasma?
Yeah. So melasma is a treatable condition, I would say. There are certain myths and hypes mentioned in the social media about melasma. Don't fall into all these myths. Just follow and get an opinion of your dermatologist. Start treatment as early as possible. The melasma decreases in the severity, and also use a very good quality sunscreen so that it does not increase. And also maintaining a good healthy lifestyle with good amount of water intake, good amount of fruits and vegetable intake also helps a lot on your skin health. So overall, talking about melasma, it is treatable. So just take a expert opinion to start your treatment as early as possible.
Right. So melasma is treatable, it's controllable, and the only thing we need to do is to start using sunscreen. If we are not using sunscreen at all on a regular basis, use it daily, no matter whether you are working out or working indoors. Use sunscreen on a regular basis, as Dr. Gupta has already, told us how to use it, how to reapply, when to reapply, how much to apply, etc., etc. Plus also, because as doctor had already pointed this out, that it grows gradually, so before it covers your face or a significant area of your face, please go and consult a doctor. As soon as you see these spots, go and consult a good qualified dermat and start taking advice, and don't fall for market gimmick or quacks, etc. Thank you so very much, Dr. Barnita Gupta, for joining us. Thank you for your valuable time. It has been a very informative session for our viewers, and it was great to hear you. We really look forward for many such sessions for our viewers with you in coming time.
Okay, thank you. Thanks a lot.
Thank you, Doctor. Viewers, thank you for your participation in today's session. Stay connected to our beautiful Spotless Skin page. Take care of yourself. Stay healthy. Stay happy. Goodbye. Have a great day ahead.